Initiative for Health Accountability and Transparency welcomes you to CPD Academy's course on healthcare quality improvement. The CPD Academy is the learning hub for health professionals such as doctors, nurses, pharmacists, midwives, and so on and so forth. My name is Monica Oche and I'll be your instructor for this course. For the duration of this course, participants are advised to take down notes or refer back to the lesson materials for this course and download the PowerPoint presentation for ease of reference. The course materials for this course include a graded pre-test quiz, which all participants must take before the course video is allowed to play, a course video on quality improvement in healthcare, a downloadable PowerPoint presentation which provides more information on the subject, a graded course completion examination quiz which all participants will be allowed to take on completion of these materials. And then we also have suggested resources on quality improvements which you would find at the end of this course. And once you click on them, it will take you to the landing page of those links. And for those who may choose to have course completion certificate or CME credit, you will need to achieve a 75% pass mark and pay a little fee to be able to get your CME credits or certificates. First on the presentation outline for this course is the learning objectives, followed by a brief introduction of the course. We'll be looking at the definition, purpose, importance, perspectives, and dimensions of healthcare quality. We'll also look at the components of healthcare quality system. We'll look at the nitty-gritty of quality improvement, its definition, purpose, benefits, and strategies. We'll also look at the difference between quality improvement and quality assurance. We'll look at the approaches and steps in healthcare quality improvement. Furthermore, on the outline for this presentation is where we'll be talking about healthcare quality measurement using quality indicators, success factors in quality improvement, healthcare quality improvement cycle, which has to do with the steps of the healthcare quality improvement. And we'll also look at the example of healthcare quality improvement in a healthcare setting. And then we'll finally take a conclusion. On completion of this course, participants will be able to know the meaning of healthcare quality. They will understand the purpose, importance, the perspectives, and the dimensions of healthcare quality. They will be able to explain the difference between quality improvement and quality assurance. They will also get trained about the approaches and steps in quality improvement. Furthermore, on the learning objectives, participants will be able to understand and know how to measure quality using quality indicators. They will also understand the success factors and the challenges in quality improvement, as well as to know how to set up quality programs in their places of work. Globally, quality of healthcare is an emerging concern, and the term has been well defined and fairly understood by a lot of people around the world, especially those in the healthcare settings, the stakeholders, the managers, even the users of healthcare facilities or healthcare services. Therefore, quality improvement processes have become popular in healthcare with continuing demand by patients and purchasers that healthcare be provided with quality. Quality of healthcare services is critical for achieving effective universal health coverage. Therefore, the provision of substandard care is no longer an option in the healthcare delivery system today. But despite the positive attempts to improve healthcare quality, there are persistent challenges that require urgent attention. Healthcare quality or quality of care is never an accident. It is always the result of high intention, sincere effort, intelligent direction, and skillful execution. Let's take a quick brainstorming session on healthcare quality. Take a moment to note down keywords or phrases on your understanding of healthcare quality. What is it that comes to mind when the word healthcare quality is mentioned? The Institute of Medicine defines healthcare quality as the degree to which healthcare services for individuals and populations increase the likelihood of desired health outcomes and are consistent with current professional knowledge. Here I'll be looking at the fundamentals of healthcare quality. Usually these are the words or phrases that come to mind or surfaces in the definition of healthcare quality. First, healthcare quality is about meeting desired health outcomes. It also has to do with consistency with current professional knowledge. And then in healthcare quality, you're talking about satisfying the health consumer, usually who is the focus of healthcare services. And in healthcare quality, we're talking about defect-free services that will be provided to the clients or to the consumers. So during our brainstorming session, did you correctly note down any of the keywords or phrases in the definition of healthcare quality? If not so, you can refer back to the course materials to see more on the phrases or keywords that should be used in the definition of healthcare quality. Now that we're well acquainted with the concept of healthcare quality, we'll be discussing some of the importance of healthcare quality. Quality is fundamental for uniformity of process, and here we're referring to established standards and norms which, when followed through, helps to reduce error, waste, and also reduce cost. Healthcare quality is also important for accreditation as it impacts positively on the accreditation of hospitals in some areas of healthcare dimensions such as efficiency, safety, effectiveness, timeliness, and patient-centeredness. It is also important because it is the right thing to do, as the consumer protection legal issues are covered around the issue of healthcare quality. It is the right thing to do also, as seen in the Hippocratic Oath, where we have ethical issues of how the conduct of our providers, doctors, nurses should be in the place of practice. It is also important for performance measurement, as well as increasing satisfaction of health consumers and invariably increasing utilization and uptake of healthcare delivery services. Healthcare quality also increases the health status of a population. As we all know, poor quality can do harm by increasing morbidity and mortality. And let's not forget that healthcare quality also has a lot of important social and economic benefits. The user or clients of healthcare services see healthcare quality as health services and activities that meet the needs of clients in achieving their expectations and outcomes, while the provider sees healthcare quality as health services and activities which meet the needs of clients and are medically safe, professionally ethical, accessible, and they are also acceptable to all. The manager, on the other hand, sees healthcare quality as health services and activities that meet the needs of clients and program goals. Such services or activities need to have certain characteristics, which includes them being safe, satisfying, affordable, accessible, and delivered in technically competent manner within the social, cultural context of the country. Well, let's look at the components of a quality system. We've been talking about healthcare quality and what it is, its importance. But now let's look at the component, what makes up the quality system. There are basically three components of the quality system. The first is the input or the structure component, which has to do with the supplies, the personnel, the equipment, and the physical resources of that ensure that quality is put in place. The second component is the process component of quality, which includes diagnostics, therapeutic, and patient care procedures and protocols, which can all be measured and quantified. Lastly is the system or results component. Here we're talking about infection rates, morbidity and mortality rates, as well as patient and employee satisfaction, which are all outcome measures. Healthcare quality has its dimensions, and these dimensions have been clearly identified by the WHO, with a reason that quality within the system requires that all stakeholders have common understanding of healthcare qualities. The dimensions of quality identified by the WHO highlights that quality in health system has to be effective, they have to be efficient, they have to be accessible. They shouldn't be far from the patients, users, or clients. Facilities should be close by. It should be patient centered, that is, the patient or the client should be the focus of care in delivering quality care. It should be equitable, whereby there is no discrimination in area of gender, ethnicity, religion, or geographical location. And lastly, it should be safe, whereby there is minimization of risk in the quality of care that is delivered to patients or clients. Let's take a second brainstorming session. Let's look at quality improvement in itself, its process. Here, I would like you to take a moment to note down keywords or phrases of your understanding of quality improvement. Quality improvement in itself is a structured approach to evaluating the performance of a system and processes and determining needed improvements in both functional and operational areas. It is the continuous process of reducing variation of performance or variation from standards in order to achieve a better outcome. Now, in talking about quality improvement, or in defining quality improvement and what it entails, some of the key factors or attributes of quality improvement has to do with identifying or evaluating the performance of the system. We're talking about determining what needs to be done in order to improve quality. We're talking about the process of reducing variation from performance, whereby we're setting standards and we're following through with standards. We're talking about achieving better health outcomes, reducing morbidity, mortality, giving patients the care that they need or that they demand for. During the brainstorming session, did you correctly note down any of the keywords or phrases in the definition of quality improvement? Well, if you didn't, here is an opportunity for you to go back to the lesson materials and then to look up for yourself the attributes or keywords, phrases that come out in the definition of quality improvement. Quality improvement is very vital in the quality delivery of services, but there's also quality assurance, and they are not the same. Quality assurance is very much different from quality improvement in as much as people interchangeably use the words. Quality assurance is the process of planning for quality, development of objectives and goals for quality, setting standards of quality, communicating these standards to the users, as well as developing indicators, setting thresholds, and collecting data to monitor compliance with these set established standards. Now let's take a quick contrast between quality improvement and quality assurance so we don't confuse the both. Quality improvement usually has to do with what can we do to improve quality. While in quality assurance, you're looking to see what went wrong in the process of delivering quality care. Quality improvement also is a proactive process, while quality assurance is usually a reactive one. Quality improvement avoids blame, while quality assurance is often punitive. Quality improvement process usually fosters system change, while quality assurance often tries to find who was at fault in the delivery of quality care. Quality improvement also focuses on the entire system, while quality assurance focuses on the specific incident that had occurred. Now you might want to ask, what is the purpose of improving quality? What is the purpose of quality improvement in a healthcare setting? The quality improvement in general helps or aims to create efficiencies and address the needs of consumers. In healthcare, with its life and death focus, it is a prime field for quality improvement initiatives. And quality improvement also has the main purpose of improving health outcomes. As we all know, health outcomes are very important. Quality improvement also seeks to improve processes and outcome measures. It can be used in facilities, in clinics, to improve health outcomes. Quality improvement also have its potential benefits. The first benefit of quality improvement we'll be looking at here is service quality. There is the improvement in service quality when you do quality improvements or carry out quality improvement programs in your healthcare facilities. It also improves the health of the clients or the users. It also has to do with increased satisfaction, which is one of the most potential benefits of quality improvement. There is client satisfaction and loyalty. There is utilization of service. Of course, when quality is at its peak, you get more utilization of facilities. It also leads to increased revenue. Where there is quality, you have patronage and you have your revenue increased. And then there is the increase in cure rate. When there is quality treatment for clients or patients, there is increase in cure rate. Now we'll be looking at the various strategies of quality improvements. What are the strategies you need to put in place for quality improvement? First, we'll be talking about empowering health consumers by way of reaching them with information, education, and communication. Empowering consumers is to help them develop self-awareness, self-care, and promote the understanding that consumers can be equal partners in their healthcare decisions. This process encourages consumers to be actively involved in the provision of health services. On the other hand, professional development involves developing specific competencies needed to achieve improvement goals such as skills. And these skills may be technical skills, interpersonal skills, or skills related to critical thinking or problem solving. Another strategy is institutional development. Here we're talking about organizational or institutional culture, which are also central to quality improvement methods. Here, there may be the need to pay attention to clinical audits, business process reengineering, and overall cultural reorientation of an organization or a healthcare facility. Management development has to do with top manager learning about and deciding to commit to quality improvement programs. This may require assessment of the current culture, consumer satisfaction, and the quality management system. The management is responsible for mapping out the critical processes through which the consumer's needs are met and oversees the formation of teams for process improvement efforts. And finally, clinical practice management or development requires instituting effective clinical governance as an integral part of healthcare quality improvement programs. The key elements to be included are clinical risk management, clinical effectiveness, person-centeredness, continuous quality improvement, and also involving key stakeholders. Now, after you have instituted quality improvement programs, how can you be assured that quality has been well established? How can quality be assured? First, in establishing quality improvement programs, you have to define standards, norms, and guidelines. And after you have defined them, you have to measure variations with performance and standards, and then you look to improve and maintain compliance with these established norms and standards. There are different approaches to quality improvement. There are three basic approaches outlined here. The first is the traditional approach, which has to do with norms, guidelines, and protocols, conducting trainings, and the use of job aids, such as the use of standards of operations. And then we're also looking at quality assurance, which has to do with teamwork, process analysis, and data monitoring. And the last approach for quality improvement is the collaborative and the interdisciplinary engagement. Here we're talking about exchange process, sharing experience, competition, and the use of best practices. Healthcare quality improvement programs, after they have been set rolling, quality has to be measured, and they are measured because they are tangible and measurable. Once the standards have been set, it is possible to measure performance in relation to each standard. Quality measurements too must be tested to ensure that they are reliable. The use of these tools results in the same reading regardless of who does the measuring or when and where the measurement is taken. These tools also have to be valid, that is, they measure exactly what it is they are intended to measure. And lastly, these tools also have to be standardized. That is, the definition of data elements, data collection, and data analysis are sufficiently precise and comprehensible that they can be understood and applied in the same way, regardless of who refers or applies them. Failure for these tools to meet standards of reliability, validity, and standardization undermines quality measure. Other methods of measuring quality also include accreditation, certification, and the conduct of surveys. Every healthcare provider wants to provide client consumers with the best service, but not every healthcare provider have idea of what constitutes the best quality or how to achieve highest quality. Quite often, a formal quality improvement process is essential. STEEP is a quality improvement tool unique to healthcare, developed by the National Academy of Medicine. STEEP quality improvement tool describes 6 goals for optimal patient care and safety. The first S in the STEEP represents safety, which has to do with avoiding injuries to patients from the care that is intended to help them. The T in STEEP represents timeliness, which has to do with the reduction in wait times that cause harmful delays to clients or patients. The first E in STEEP represents effectiveness, which has to do with providing services based on scientific knowledge to all who should benefit, that is, avoid overuse, or refraining from providing services to those that are not likely to benefit from it, that is, here you'll be avoiding underuse. The second E in STEEP represents efficiency, which has to do with avoiding waste and providing the most efficient care to clients or patients. And the third E in STEEP here represents equitability, which has to do with providing care that does not vary in quality because of the personal characteristics of the clients or users. We're talking about characteristics such as gender, ethnicity, geographical location, and socioeconomic status. The last P on STEEP here represents patient-centeredness, where we're talking about patients being the focus of care, providing care that is respectful of and responsive to individual patients' preferences, needs, and values. Measuring quality is achieved using indicators to determine the performance of the components and comparing them with the desired standards. Quality indicators are norms, criteria, standards, and other direct qualitative and quantitative measures used in determining the quality of healthcare or reflect the standard of care. They are critical for healthcare organizations to keep track of quality of healthcare services. When developing indicators to monitor quality, it is important that one needs to consider various organizational levels of the healthcare system. The operational or the facility levels, the intermediate, tactical, and strategic levels. The indicators will vary based on the level of care and on the specific standards selected for the measuring of quality. The quality assurance teams should select indicators that use available data collected through the routine health information system. Now, looking at these levels and the different use of indicators, the operational level refers to the facility where processes that directly affect users and generate the monitoring data are carried out. The intermediate level involves decision makers who influence quality and the delivery of care, such as heads of departments, sections, or services. The strategic level includes top management and political decision makers at both local, provincial, and national levels. Now, looking at the differences between these levels or among these levels, we'll be looking at some critical features such as the monitoring objective, the process, and the people involved at these various levels. For the operational level, which is the facility level, we're talking about tracking service delivery processes, results, and the availability of input. The process involved here emphasizes on individual processes or services at the facility level, like we said earlier. And the people involved here emphasizes on individual processes or services at the facility level. The intermediate level or tactical level here compares processes carried out at the operational level. The process emphasizes the results and products of the combined processes or services. The people involved emphasizes the results and the products of the combined process or services. The strategic level evaluates the overall system results, compare results with objectives, act on differences, assures the quality of the entire system. The process also emphasizes the overall results of the system and strategy to better meet objectives. The people involved here are top organizational management at the national, regional, and local government levels. Now, let's look at some of the examples of quality indicators. Highlighted below are a list of quality indicators that can be used to measure quality. Here we're looking at average patient wait time, which usually should not be greater than or more than 30 minutes. Percentage of left against medical advice cases. Average length of stay. Staff-patient ratio is also an indicator for quality. Patient's confidentiality is a very important indicator. Percentage of cases developing abscesses after injections can also be seen as an indicator. Surgeries that are postponed are also indicators. Percentage of newborn where birth weights are not recorded are also indicators. Dropouts between OPV1 and OPV3 or measles 1 and measles 2 are also examples of quality indicators. Some of the indicators for quality also include percentage of dehydration deaths in diarrhea, percentage of IPD admissions, percentage of cases with HB, percentage of repeat X-rays, usually not greater than 10%, is often prescribed. And then the percentage of enteric cases developing enteric ulcers is also key and as an example of indicator. Now, there are some success factors that should be incorporated in the quality improvement programs. These factors are very important and should be met in order for a system to achieve quality status. Now, let's take a third brainstorming session. What are the key success factors in quality improvement? You take a few moments and note down 5 success factors in quality improvement. Highlighted here are 11 key success factors in quality improvement. First of these key success factors is leadership. Health leaders and managers should have required knowledge and skills in quality assurance and management. And the second success factors in quality improvement here is commitment. Health leaders and managers must show not only verbal commitment but also active and practical commitments towards the quality improvement programs, they should get involved in the decision making aspect of quality improvement and also participate in the committees that are involved in launching quality assurance teams, and they should also provide the necessary support for these teams to succeed. Another key success factor in quality improvement is patient centeredness, which is talking about the focus being on the patient, like we have said earlier. One of the main goals of healthcare quality improvement is to meet the needs and expectations of the patient, both internal and external. So, therefore, a quality improvement program has to succeed if only it carefully identifies its clients and learn their needs and expectations and find ways to meet these needs. And also reorient healthcare model to focus on holistic approach to healthcare and shifting from inpatient to outpatient and ambulatory care. Continuous process oriented and outcome driven improvement is another key success factor for quality improvement. Improvement must be continuous and it must be directed at process and also driven by the goal of achieving the right outcome. Outcome goals should be chosen based on patients' impact and health system priorities. Without a well-developed plan for action taking into consideration these issues, quality improvement efforts may not succeed. Another key success factor for quality improvement in the health system or healthcare facility is healthcare providers' empowerment. Each healthcare provider should be trained and continuously developed to render the best possible service to the external patients or clients. They should be given the tools and the techniques to make decisions on their own and should be supported in their efforts of meeting the needs and expectations of clients. A quality improvement effort that does not consider the needs and assets of the provider is doomed to fail, of course. Proactive improvement is an approach to problem solving and to identifying opportunities for improvement, being a key success factors in quality improvement. Healthcare organizations should stay away from the traditional crisis management, where improvement is initiated only after a crisis or a mistake occurs. This situation will create a sense of laziness and an inability to innovate by quality assurance teams. The use of data is also paramount in quality improvement efforts. A system of data management should be fostered in order to adequately and correctly manipulate data, produce information necessary for appropriate decision-making activities. Quality improvement is based on decision-making activities, and without the necessary data, these decisions become arbitrary and may not be correct. And may I emphasize that if all healthcare providers work on their own without interaction with one another, then the systems may never see the fruits of the synergistic effect teamwork can bring. This brings us to interdisciplinary teamwork. One member of the team may bring one perspective and another may build on that perspective to bring about a better perspective, and so on and so forth. Therefore, working in teams is not only to achieve collective decision-making capabilities, but to achieve progressive and compounded capabilities through the participation of all the team members. And of course, continuous development of human resource for health of the health system or health facility is one of the requirements of a healthy and improving system. Almost all experts agree that investing in your employees is highly predictive for ultimate success. An organization that has its employees satisfied has a perfect environment for improvement and breakthroughs. When morale is high, productivity is at its best. Hence, we'll be looking at the quality improvement circle. As you can see in the circle, you have 4 different colors with different word inscription. The first is the green, the dark green, which has to do with the plan, and the second with the inscription do, the third, which is the orange block with the inscription check, and the fourth with the blue color is with the inscription act. Now, in the plan phase of the improvement circle here, you are looking at what is the goal, what is now preventing us from achieving this goal. And then the do parts, here we're talking about what is one step you can take towards the goal right now in order to achieve quality improvement. The check phase has to do with here you're answering the question, did it work? If so, great. And if it didn't work, then you have to try again and do something else. The act phase here, we're talking about standards and norms, where you have to standardize and stabilize what worked or didn't work, and then you have to go through the process again. Now, looking at the steps in these phases of the quality improvement cycle, the first step here is where you have to plan for quality improvement. A quality plan defines what an organization wants to improve, how it will make improvements, how it will test for success, and what are the anticipated outcomes and evidence of success. It is also the monitoring and evaluation tool that provides the roadmap and outlines deliverables for a quality improvement program. The second step here is setting standards for the most critical features. Here you'll be setting standards and identifying or accessing the modality of measuring each selected quality feature. Once the standards are defined, this improvement is translated into standards that define the level of performance to be achieved according to this measure. And here are some of the few examples of formulating standards in quality improvements in a primary health care. Here we'll be looking at critical feature, the measurements and thresholds. As you can see, some of the critical features here are midwives working in a health care center, antenatal visits by pregnant or expecting mothers, vaccination of 12 to 23 months old children, visual problems in school-age children, mortality from severe diarrhea in under 5 children, maternal and prenatal mortality in malaria endemic areas. As you can see alongside them, there are the measurements and the thresholds. The third step for the quality improvement cycle is the measurement of performance. Of course, when quality is established, measurement of performance has to be carried out. Once the standards have been set, it is possible to measure performance in relation to each standard. In this regard, the health staff collects and records performance against standards using the chosen measures. To assess the level of performance, a representative sample of activities is selected and data related to their performance is collected. The fourth step of the quality improvement cycle is the reassessment and maintenance of quality. The purpose of the reassessment process is to ensure that quality improvement measures are put into practice and maintained. Outstanding deficiencies are also evaluated in this step, and necessary remedial measures are identified and implemented. The use of standards in the quality improvement cycle is an effective way to initiate and drive organizational changes in a never-ending chain of continuous improvement. In this process, the emphasis should be laid on the organizational and attitudinal changes necessary to support quality. In addition to the standards that guide quality improvement, through this approach, a process of continuously improving quality is set in motion. Fifthly, action to improve care is also another step in the cycle. The goal of quality improvement is to undertake interventions that improve the performance and impact of primary health care services. If no deficiencies are detected, a congratulatory feedback will constitute an incentive that will further raise staff awareness and stimulate their commitment to the quality improvement process. In the case of deficiencies, the necessary corrective interventions should be implemented. Such interventions may be simple or complex, thus requiring a problem-solving analysis process. In healthcare organizations, quality assurance teams are essential to improve health outcomes and hospital reimbursements. Quality assurance teams identify areas needing attention. They also set quality goals, develop strategies, collect and analyze before and after data. They go as far as integrating departmental programs, facilitating team building throughout the organization. As compliance specialists, quality assurance personnel ensure that medical facilities adhere to relevant federal, state, and local laws and regulations. They also ensure that institutions meet criteria for accreditation by relevant accrediting organizations. Other activities of the quality assurance teams may include monitoring the proportion of certified health professionals available to patients. They also ensure the transformation of data to electronic medical records. They encourage preventive care and wellness programs to avert illness and improve the health of those already diagnosed with diseases. They also track patient outcomes. Here we're talking about measuring complications, readmissions, and mortality to link therapies and policies to efficiency. So now we'll be looking at an example of quality improvement in a healthcare setting. Here we'll be looking at a scenario where a patient is helped to find their way, and the problem here is that a scene in a healthcare setting where a receptionist observed that a patient was not able to read the displayed signs, or perhaps the signs may have been unclear, and the patient was confused about where the laboratory was located, so it's difficult for him to find his way to have blood drawn. The solution to this problem would be that a first option of solution will be giving the patient direction, or secondly calling someone to assist the patient, or thirdly possibly walking the patient to the laboratory if nearby, and if there is another receptionist at the office, to take the place of the receptionist who is rendering help at that time. The result of this is that the patient will be pleasantly surprised by the courtesy and friendliness of the receptionist, and of course you get a thank you for helping the patient. The outcome would be that it will be a non-medically addressed problem, but then the client will be satisfied and will be happy with the services rendered. The lesson learned from this is that there will be a need to form a team to address this kind of issue, and also to prevent it from reoccurring in the future. The first thing to do in order to address issues like this is to code each clinical area with a color, or put colored directional lines along the wall. Or possibly an individual health worker and hospital staff should be empowered to identify opportunities for improvement and take the initiatives to identify and fix problems like this when they arise. These improvements might seem small, but nonetheless, its effects can be far-reaching, as satisfied clients might be more inclined to revisit the facility and encourage others to do the same, hereby leading to increased utilization of healthcare services. To conclude, globally, quality of healthcare is an emerging concern, and the term has been well defined and fairly understood. Quality improvement processes have become popular in healthcare, with continuing demand by patients and purchasers that healthcare be provided with quality. Quality within a health system requires that all stakeholders have common understanding of healthcare quality. Quality of healthcare services is critical for achieving effective universal health coverage. Therefore, provision of substandard care is no longer an option. The goal of quality improvement is to undertake interventions that improve the performance and the impact of healthcare services. Despite positive attempts to improve healthcare quality, there are persistent challenges that require urgent attention. Therefore, necessary corrective interventions should be implemented. Such interventions may be complex or simple, requiring a problem analysis or a problem-solving technique. So we have highlighted here some of a few suggested resource materials on quality improvement. You can just click on the link and it will take you to the landing pages of these resources for further reading and further understanding of the concept of quality improvement. Healthcare quality is an important dimension of universal health coverage. Let's not forget, access to healthcare is critical, but access to quality healthcare is a prerequisite. It is very important. Care that is unnecessary or inappropriate for a patient's condition not only creates more problems than it solves, it can be extremely dangerous to the patient. And that brings us to the end of this course video. I hope you enjoyed it and you have learned all there is that you can learn on quality improvement. But don't forget to refer back to the resource materials to equip yourself more on quality improvement. Thank you for watching.